Good afternoon, Dr. Hostmans and distinguished guests. The COVID-19 pandemic has claimed around about 300,000 lives and infected over 4 million people worldwide and is having a profound effect on all aspects of life. The subsequent containment measures of social distancing and isolation can have a detrimental effect on mental health now and in the future. Increased social isolation and loneliness have been identified as risk factors of psychological distress. As such, there is an impetus for research to address the measures that mitigate the mental health consequences for at-risk groups. More than a fifth of the world population has been under various measures of lockdown due to the global infections of COVID-19. Recent pandemics have provided insight into the effects of isolation on mental health. And they've found high prevalence of psychological distress amongst people in quarantine and isolation in Toronto due to the SARS pandemic. Specifically, 31.2% reported depression and 28.9% reported PTSD. Longer durations were associated with higher prevalence. The Korean study of MERS found core issues of anxiety and fear. In fact, 6 months after the removal from isolation, symptoms of anxiety persisted in patients and isolated people. New data is emerging from the current pandemic, and studies have been examining psychological distress experienced by individuals infected, under quarantine, and the general public. They found anxiety was present across all groups, whereas depression was highest amongst patients with COVID-19. Preliminary analysis of the most up-to-date literature has noted recommendations to mitigate the mental health impact of the current pandemic. However, increasing online therapy relies on trained mental health practitioners, appropriate infrastructure, and acceptance by the general public. It's proposed interventions that empower individuals with protective measures to cope with the psychological effects of isolation may provide alternative and effective avenues towards well-being. Mindfulness techniques have been incorporated into a number of interventions designed to reduce psychological distress. Researchers have been speculating as to the potential processes behind this effect. Equanimity, the process of maintaining a stable attitude where there is an acceptance of both negative and positive feelings, has been identified as an essential psychological element associated with the improvement of well-being reported in mindfulness practice. Through the development and construction of the phenomenological experience of equanimity measurement, Hostmans identified equanimity as the quality that mediates the relationship between mindfulness and psychological distress. Emerging literature has revealed targeted psychological interventions are urgently needed. Furthermore, there's an opportunity to overcome some of the barriers and limitations highlighted in the literature to examine protective strategies to cope with isolation. The identification of equanimity as the underlying factor associated with the beneficial mental health outcomes from meditation practice has led to the focus of the current research to examine equanimity and its protective effects during the challenging time of isolation with the current pandemic. Specifically, this study aims to explore if equanimity mediates a relationship between isolation and psychological distress. Participants for the study will be recruited via Amazon Prime. To assess meditative equanimity, the phenomenology of meditative equanimity measure will be utilised. Developed and constructed by Hostmans 2017, the 20-item scale has demonstrated validity and comprises of 2 factors, centering and resonating. The K10 will be used to examine psychological distress. This 10-item questionnaire yields a global measure based on the depression and anxiety symptoms experienced over the past 4 weeks. Social isolation will be measured on a 1-item isolation scale. The research study will take 3 months to complete. The research question, literature review, and ethics approval will be completed in 4402. The data collection and results write-up will be completed in 4403. The significance of this study is until there is a vaccine or cure, containment of the virus is the focus. This indicates isolation will be part of our lives in the near future. The $48 million federal funding to support the mental health and wellbeing pandemic response plan and $74 million for preventative mental health services indicates the resultant mental health concerns are being considered as serious as the medical ones. This provides an opportunity for this study to be part of a greater understanding and development of effective interventions and protective measures aimed at reducing psychological distress during this and future pandemics. Thank you so much for your time.